Welcome to this edition of the First Aid Show. Sometimes a paramedic may ask for silence at a scene. Sometimes bystanders are confused by this, so we asked a paramedic, why is absolute silence on the scene sometimes important?
If you're at a really serious emergency and the critical care teams have come from the air ambulance, you will often find that they ask for absolute silence on scene. This can be because they've administered a drug that if the person that's receiving this drug hears lots of noise and interruption and shouting, it can have nasty after effects and flashbacks. So we ask for everything to be calm and relaxed, particularly if they're giving somebody a general anaesthetic or giving them these particular drugs. It's for the best interest of the patient, so please listen and be guided by the crew. So to give an example, there was a young patient of ours, a young boy, who was playing football and had a head against another player's head collision, collapsed to the floor and then started having a seizure. The critical care team flew in by helicopter to come and manage this patient because of the head injury, and they administered a drug that helps keep him safe, and they were going to give him a general anaesthetic. Because it was a playing field, a sporting field, there were whistles, noises, matches taking place. When we met the patient afterwards and he'd made a full recovery, he had flashbacks that he was being chased by dinosaurs. And that probably is because of the noise and interruptions of the environment. And that's why often they will ask for absolute silence and calm to make sure that the patient doesn't have any of those after effects.